She kept thinking, the arthritic joint is gone now. Why does nighttime still feel this hard? What Claire had not been prepared for is that surgery changes far more than the joint itself. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. Have you ever noticed that after knee replacement, nighttime can suddenly feel like the hardest part of the entire day? You may get through physical therapy. You may manage the exercises. You may even start moving better during the day, but then nighttime comes and suddenly your body feels uncomfortable in every position. Your mind feels more alert than it should, and sleep becomes unpredictable in a way that feels exhausting. By the end of this episode, you'll understand why sleep often becomes so difficult after knee replacement and why that experience is usually connected to much more than simply not being tired enough. This episode begins a brand new 4-part series on sleep after knee replacement because sleep disruption is one of the most common experiences people describe after surgery, yet many people say nobody fully explained why nighttime can suddenly feel so difficult. Many people expect soreness, stiffness, swelling, and physical limitations after surgery. What catches them off guard is how much the entire sleep experience changes. Some people describe waking up constantly through the night. Others feel exhausted all day, but then unable to fully settle once they finally get to bed. Some fall asleep normally, but wake up at 2 or 3 in the morning and feel like their brain never completely powers back down. And one reason this experience catches so many people off guard is that sleep after knee replacement often feels completely different than they expected. During the day, there are usually tasks to focus on. There are appointments, exercises, errands, distractions, conversations, and movement. But nighttime becomes much more still. There are fewer distractions. Your nervous system can become more aware of discomfort, stiffness, pressure, swelling, temperature changes, and positioning. That does not automatically mean a complication or a serious problem is developing. In many cases, it reflects the reality that knee replacement is a major surgery that temporarily changes how your body regulates discomfort, stress, swelling, movement, and nervous system alertness. And that change in your nervous system becomes incredibly important. Many people think about sleep problems only through the lens of pain, but after knee replacement, sleep disruption is often connected to multiple overlapping systems at the same time. Pain, swelling, positioning discomfort, medication timing, disrupted routines, stress, and a reduced daytime activity can all contribute simultaneously. But there's also something else happening that many people do not fully expect. After surgery, the body often stays in a more alert physiological state for a period of time. The nervous system has gone through a major event. Tissues are healing. Inflammation is elevated. Movement patterns are changing. Daily routines are disrupted. Activity levels fluctuate. Your brain continues monitoring the knee, movement, and discomfort throughout the day. And sometimes that heightened state carries directly into nighttime. Researchers studying sleep after total knee arthroplasty have consistently found that sleep quality commonly worsens during the first several postoperative weeks, with many people experiencing fragmented and unpredictable sleep patterns during the earlier phases after surgery. Frequent awakenings, nighttime discomfort, and difficulty returning to sleep once awake are all commonly reported. So if this is happening to you, you're in very good company. Some studies using sleep monitoring have shown that disruption can unfortunately remain significant for several months after surgery, even while daytime pain and mobility are improving. And that is where people often start feeling caught between physical exhaustion and a nervous system that still does not fully settle down at night. It seems like if the body is physically tired, sleep should happen automatically. But fatigue and sleep regulation are not identical processes. After surgery, the nervous system may remain physiologically activated even while the body feels exhausted. Inflammation increases after major surgery. Pain processing systems become more sensitive. Medications can alter sleep architecture, and normal daily rhythms become disrupted. Reduced daylight exposure, inconsistent activity patterns, daytime napping, and limited physical movement during the early postoperative period can also influence nighttime sleep quality. That combination is one reason many people describe feeling physically exhausted but mentally alert at the same time. You may already recognize this experience yourself. Maybe you feel sleepy while sitting in the chair during the evening, but the second you lie down, your brain suddenly feels more awake. Maybe you finally get comfortable, fall asleep for a short period of time, then wake up fully alert again after changing positions or noticing stiffness in your knee. That experience is very common after a knee replacement. One reason nighttime often feels worse is because the brain has fewer competing inputs once the day quiets down. During the daytime, there are conversations, errands, appointments, movement, and distractions. At night, your environment becomes quieter and your attention shifts inward. Swelling becomes more noticeable. Pressure along the incision becomes easier to feel. Stiffness, after remaining in one position, becomes more obvious. And swelling itself often behaves differently later in the day. Many people notice that their knee feels more uncomfortable at night after a busy or active day. That pattern makes physiological sense. Increased daytime loading often leads to increased fluid accumulation and inflammatory activity later in the evening. Your knee may feel warmer, tighter, fuller, or throbbing a bit more at night compared to earlier in the morning. And that doesn't automatically mean that your knee has been damaged or that something has gone wrong surgically. It often reflects the normal interaction between tissue irritation, fluid accumulation, activity tolerance, and post-operative sensitivity. Unfortunately, once somebody experiences several difficult nights in a row, another layer often develops. The brain starts anticipating sleep problems. People begin monitoring whether they are sleepy enough. They start checking the clock and calculating how many hours remain before morning. They become hyper-aware of position changes and sensations around their knee. That heightened monitoring can increase physiological alertness even further. This doesn't mean the problem is just anxiety. It means the nervous system is responding to repeated discomfort, interrupted sleep, and increased attention to the knee. Human sleep tends to work best when the nervous system feels relatively predictable and settled. After knee replacement, many normal routines temporarily stop feeling predictable. Even something simple like rolling over in bed may suddenly require planning because of incision sensitivity, swelling, pressure, or stiffness. Imagine someone named Claire. Before surgery, she had already spent years waking up because arthritis pain in her knee made it difficult to get comfortable at night. She assumed knee replacement would finally solve the sleep problem. Instead, she found herself awake at 2 a.m, repositioning pillows, adjusting her knee, and wondering why her body still would not fully settle down. What frustrated her the most was not simply being awake. She kept thinking, the arthritic joint is gone now. Why does nighttime still feel this hard? What Claire had not been prepared for is that surgery changes far more than the joint itself. Before surgery, many people already have deeply established sleeping patterns. They sleep on one side, they bend one knee, they rotate positions automatically without thinking about it. Surgery temporarily changes what feels available and what feels comfortable. Suddenly, there may be pressure sensitivity around the incision, swelling around the joint, tightness along the quadriceps, temperature sensitivity, or stiffness after remaining still for too long. Positions that once felt automatic may suddenly feel awkward. And when sleep becomes inconsistent for several nights in a row, people often start realizing that the experience extends far beyond simply being awake at night. Research examining sleep and postoperative pain has repeatedly shown that disrupted sleep and pain can influence one another bidirectionally, with each one potentially reinforcing the other over time. And this is one reason some people feel discouraged. When daytime function improves faster than nighttime sleep, they may move better during the day yet still struggle once evening arrives. Sleep patterns after knee replacement are rarely perfectly linear. More active day may lead to a more uncomfortable night because swelling, tissue irritation, and sensitivity often increase later in the evening. Medication timing can also influence nighttime patterns, especially as medications wear off overnight. And comparison between people can become misleading very quickly. One person may sleep reasonably well after surgery, while another struggles for weeks or months. Baseline sleep quality, pain sensitivity, stress levels, medication responses, and medical history all differ from person to person. That becomes important because many people assume something is wrong if sleep has not normalized quickly. But research examining sleep after total joint arthroplasty has shown that disrupted sleep can remain present well beyond the earliest postoperative phase, even while daytime function improves. And after several difficult nights in a row, many people start anticipating nighttime before it even arrives. Their brain starts preparing for another difficult night, and that anticipation alone can increase nervous system alertness. This is why sleep after knee replacement often becomes much more than simply finding the right position. It becomes an interaction between tissue irritation, swelling, nervous system alertness, sleep monitoring, inconsistent activity patterns, medication effects, and nighttime attention to symptoms all occurring together. And if you're listening to this thinking, this sounds exactly like what's been happening to me, many other people describe very similar experiences after surgery. One thing I also want to mention is that many people start wondering whether poor sleep automatically means something is wrong. In many cases, it does not. Of course, persistent lack of sleep should be discussed with your doctor. Also, worsening symptoms such as severe uncontrolled pain, significant calf swelling, shortness of breath, fever, wound drainage, or other concerning medical changes should always be discussed with your surgical team. There's also an important difference between understanding why sleep becomes disrupted after surgery and understanding what disrupted sleep can start changing throughout the rest of the postoperative process. We're going to focus on those downstream effects much more directly in the next episode. And if this episode helped you better understand why sleep can feel so different after knee replacement, make sure you're signed up for the Total Knee Success Insider newsletter. I share ongoing educational content there designed to help people better understand the different phases after surgery. And my new book, Making Sense of Pain After Knee Replacement, is now available on Kindle, and the print version will be released on May 30th. It explores why pain sometimes lasts longer than expected after knee replacement, and some of the emotional side of the process after surgery through the realities people experience every day after knee replacement. I'll place the links in the show notes. In the next episode, we're going to answer the questions many people start asking after several difficult nights, including why discomfort can suddenly feel louder, why energy feels different during the day, why progress can feel inconsistent, and why poor sleep after knee replacement often affects much more than nighttime alone. So if you're listening to this thinking, okay, but what do I actually do about all of this? Don't worry. In episodes 77 and 78, we're going to start talking about practical strategies people use to finally start getting more consistent sleep again after total knee replacement. Thanks for joining me today. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.